Benign prostatic hyperplasia, BPH, also known as prostate gland enlargement, is a common condition in aging men. It involves the non-cancerous growth of the prostate gland, which can lead to various urinary symptoms due to the prostate's proximity to the urethra and bladder. Below is a comprehensive overview of its signs, symptoms, diagnostic methods, and treatment options. Signs and symptoms. BPH symptoms primarily affect the urinary system. They are generally categorized into two groups: obstructive and irritative symptoms. Obstructive symptoms: difficulty starting urination, hesitancy, weak urine stream or a stream that stops and starts, incomplete bladder emptying leading to a feeling of residual urine, straining to urinate, prolonged urination time. Irritative symptoms: increased urinary frequency, especially at night, nocturia, urgency, a sudden compelling need to urinate, dysuria, pain or discomfort during urination, urge incontinence, where there is an involuntary loss of urine. In severe cases, BPH can lead to urinary retention, which is the inability to urinate at all, and other complications like bladder stones or recurrent urinary tract infections, UTIs. Recognition and risk factors. Risk factors for BPH. Age. BPH is rare in men under 40 but increases significantly after the age of 50. Family history. Genetics can play a role. Having a close relative with BPH increases risk. Hormonal changes. Imbalances in testosterone and dihydrotestosterone (DHT) contribute to prostate growth. Lifestyle. Sedentary lifestyles, obesity, and certain diets, low in fruits and vegetables, may increase risk. Other conditions. Diabetes, cardiovascular diseases, and erectile dysfunction are associated with a higher risk of BPH. How to recognize BPH. If a man experiences any combination of the symptoms listed above, especially difficulty urinating or frequent nighttime trips to the bathroom, it's advisable to consult a healthcare provider for evaluation. Diagnosis. Diagnosing BPH involves a combination of patient history, physical examinations, and diagnostic tests. Key diagnostic steps include medical history, understanding the patient's symptoms, lifestyle, and medical background. Digital rectal exam, DRE. A healthcare provider checks the size, shape, and consistency of the prostate. Urine tests, to rule out infections or other causes of urinary symptoms. Prostate-specific antigen, PSA, test. Elevated PSA levels may indicate BPH, but are also associated with prostate cancer. Ultrasound. Transrectal ultrasound, TRUS, can help assess prostate size. Urodynamic tests. These measure the bladder's ability to empty and the strength of the urinary stream. Cystoscopy. A small camera is inserted through the urethra to visualize the bladder and prostate. Treatment options. Treatment for BPH depends on the severity of the symptoms and their impact on quality of life. Options range from lifestyle modifications to surgical interventions. 1. Lifestyle modifications. Limit fluid intake in the evening to reduce nighttime urination. Avoid caffeine and alcohol, as they can worsen urinary symptoms. Maintain a healthy weight and engage in regular physical activity. Practice timed voiding or double voiding to empty the bladder more effectively. 2. Medications. Medications are often the first line of treatment for mild to moderate symptoms. Alpha blockers, e.g. tamsulosin, alfuzosin, relax the muscles in the prostate and bladder neck to improve urine flow. 5-alpha reductase inhibitors, e.g. finasteride, dutasteride, reduce prostate size by blocking hormonal changes. Combination therapy. A combination of alpha blockers and 5-alpha reductase inhibitors may be used for greater effectiveness. Anticholinergics or beta-3 agonists. These are used for overactive bladder symptoms. 3. Minimally invasive procedures. Minimally invasive treatments are recommended when medications are insufficient or not tolerated. Transurethral microwave thermotherapy, TUMT, uses microwave energy to shrink prostate tissue. Transurethral needle ablation, TUNA, delivers low-level radiofrequency energy to destroy part of the prostate. Prostatic urethral lift, PUL, implants are used to hold the enlarged prostate away from the urethra. Water vapor therapy, RESM, Steam is used to destroy excess prostate tissue. 4. Surgical options. Surgery may be necessary for severe BPH or when other treatments fail. Transurethral resection of the prostate, TUR, the most common surgical procedure which removes excess prostate tissue. Holmium laser enucleation of the prostate, HOLEP, a laser procedure that removes large prostate growths. Open prostatectomy. For very large prostates, a surgeon may perform an open procedure to remove tissue. Newer technologies. Procedures like green light laser therapy or thulium laser enucleation are becoming more widely used. Complications if untreated. If left untreated, BPH can lead to complications such as acute urinary retention, requiring emergency catheterization, chronic bladder damage or kidney damage, recurrent urinary tract infections, bladder stones due to incomplete emptying, monitoring and follow-up. Even if symptoms are mild, regular follow-up with a healthcare provider is essential to monitor the progression of BPH and evaluate the effectiveness of treatments. Lifestyle changes and periodic re-evaluation help manage this chronic condition effectively. Conclusion. Benign prostatic hyperplasia is a common and manageable condition that requires a tailored approach based on symptom severity and patient needs. Early diagnosis and appropriate treatment can significantly improve quality of life while minimizing the risk of complications. Men experiencing urinary symptoms should not hesitate to seek medical advice, as effective treatments are readily available.